Hi, good morning Felix. My name is Tasia Marcus. I'm your invigilator for the OET speaking session on the 17th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Felix Marcin.
And what is your candidate number, please?
My candidate number is 210230442.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What job duties and field work have you handled in the past in your nurse job?
I have handled different kinds of job duties as an ICU nurse. From changing the patient's drip to changing casts, dressings and monitoring the patient's vitals, I can pretty much handle all jobs and field work that any other senior nurse of an ICU can handle. I also have years of experience in using computers and medical software to upload and maintain patients' files, important medical information, and other related data. When I have completed attending to the patients in the ICU, I can take care of the technological aspects of the job on the computer as well. I can confidently say that I'm well trained in all the ICU nurse skills that one would require in order to be a successful nurse.
Describe what your ideal work week would be.
According to me, and on the basis of my previous experience, a work week begins on Monday morning and ends on Saturday evening. When I enter my workplace on Monday morning, I make sure that I browse through all my emails, take instructions from seniors, and take feedback from colleagues who have been present the night before to follow up on the progress of the patients. Based on the tasks given to me by my seniors, I plan out the rest of my week meticulously and keep a to-do list prepared so I don't miss out on anything.
Have you ever taken a break from your job position?
The job of an ICU nurse can be one that is emotionally exhausting, and in some cases mentally traumatic. As an ICU nurse, I was repeatedly dealing with accident victims, burn victims, victims suffering from different kinds of cancers, and more. All of this took a major toll on my mental health. I started getting so emotionally involved in the cases that it triggered a slight depression. When this happened, I realized that, if I wanted to successfully continue my career as an ICU nurse, and treat patients in an appropriate manner, and bring them back to excellent health, I would need to be mentally strong. I decided to take a year off, to stabilize my mind, and also to train my mind to handle such traumatizing cases, with strength and detachment. When I went back to work a year later, there was a lot more professionalism in my way of working.
Give an example of a time you had to interact with a hostile patient. How did you handle the situation, and what was the outcome?
Unfortunately, hostile patients often are part of the job. It's important to remember, some of the patients are being hostile because they are in pain, away from family, and in the hospital setting. There was a time a patient refused to take her medication. I tried everything, but she would spit them out at me when she tried to take them. Because of this behavior, I involved my charge nurse, the physician in charge of her care, and social worker. After many conversations and phone calls, it was determined the patient was spitting the medication out because she liked it mixed in chocolate pudding. The woman was elderly and suffered from dementia. It was only after speaking with a social worker did we learn of her medication preference. She was not able to communicate with us her wants and needs, and this led to hostility.
Describe a time you were faced with a patient who chose not to communicate or disclose important information. How did you handle the situation, and what was the outcome?
A parent once didn't disclose that the father of the child was not her current boyfriend. This was important, as the patient was going to need consent forms signed, and legally, this boyfriend was not able to sign the consent forms. Additionally, there was a man calling the unit, claiming to be the father of the child. Social work and the nurse manager were notified. Through an open conversation, the mother disclosed the correct identity of the father. While I personally did not discover the information, it is essential to know the resources that are available to you, and utilize them to the best of your ability.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Excuse me. Can I have a name for the child, please?
You can call him Stefan.
Thank you.
No worries. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Hello, good morning. My name is Felix Marcin. I am one of the registered nurses working in this department. How is Stefan now?
Good morning, nurse. I think he is a bit better now.
Okay. Well, you seem to be a bit upset. Is there any particular concern?
Nurse, I am really upset that my baby is in the hospital, especially as he is so young.
I can understand your feelings. Nothing to be alarmed about his condition. Well, before proceeding further, how may I address you?
You can call me Tisha.
Tisha, We are providing your baby the best possible treatment with utmost care. Our frequent visits are to ensure every child in the ward is getting enough attention. Don't be upset, Teja.
But nurse, being a mother in a hospital, with an unfamiliar condition, is quite stressful.
I recognize your worries, Teja. Stefan's condition, that is bronchiolitis, is a common type of chest infection. And he will be better soon.
I know, here in this hospital, he is getting the best treatment. Nevertheless, I find all the equipment and tubes very distressing. Are they all really necessary?
Your words are really sensible. I know, as a parent you will be undergoing tremendous stress. And above all, seeing them attached to your baby will be disturbing you as well. Perhaps, they are really necessary, and they aid your baby with the vitals.
All right.
Teja, I think as a parent, you should be aware of these equipment attached to your baby. I will explain them to you.
Okay, nurse.
Now, there's a tube connected to the nose. One being named nasal cannula serves the extra oxygen required for your baby.
Okay.
And the second one, inserted through the nose to the stomach, is an esogastric tube by which the food is provided.
All right.
The other is an oxygen probe, which is used to measure oxygen saturation. I can assure you that these are essentials, and moreover, it will not cause any disturbances to your baby as well.
Okay, nurse. I got it. Thank you for the explanations.
It's my pleasure, Teja.
Nurse, I still don't know how my child became so ill.
Your thoughts are really considerable. I think, if you know more about your baby's condition, you will get much relief than now. Currently you are quite upset, and that leads you to depression like this. Well, I would like to draw your attention for a while, please.
Sure, nurse. You may please proceed.
Thank you, Teja. Your baby's condition is called bronchiolitis. Now, bronchiolitis is a common lung infection in young children and infants. It causes inflammation and congestion in the small airways, known as bronchioles of the lung. Bronchiolitis is almost always caused by a virus, either from contact or airborne.
Okay.
Most children get better with care at home. However, a small percentage of children require hospitalization. Now, Teja, accept it as a common health condition, and nothing much to get upset about. We are here to help your baby.
I understand it, nurse.
Do you have any more concerns, Teja?
Nurse, I am worried that I did something to cause this illness to my baby.
I can understand what you are saying. However, the point to be noted is that it is a common virus, and can be infected anyhow. Hence, I insist you to stop worrying by thinking about the causes. I suggest you to look after your baby, and hope for the best.
Yes, nurse. I will. And I hope my baby will be better very soon.
Definitely, Teja. Your baby will be perfectly all right very soon. Stay hopeful like this. Once your boy's condition gets stable, the doctor will let you know regarding the discharge. And thereafter, he can lead a normal life. Are you happy now?
Yes, nurse, I am somewhat relieved now.
Do you want me to clarify anything else?
Not really, nurse. Thank you.
Okay, Teja, if you need any assistance, please press the bell on the left side of the bed. We will be here in no time.
Sure, thank you, nurse.
You are very welcome. I wish your baby a quick recovery.
That is the end of your OET speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.